Hello, my name is Parham Sadeghipur from Rajai Cardiovascular Medical and Research Center in Tehran, Iran. Today, along with my co-chair, Dr. Behnoud Bigdeli from Brigham and Women's Hospital in Harvard Medical School, we are honored to announce the initial result of Inspiration trial. As you all know, COVID-19 has infected more than 85 million people with 1.8 million deaths. Thrombosis both in veins and arteries and also in small vessels to large vessels has been one of the main features of disease. However, until now, we have no high-quality evidence for guiding us regarding the antithrombotic treatment. Some experts, due to this high rate of thrombotic event, has even advocated us to use larger dose of anticoagulation in patients with COVID-19. This variety of opinions has led to various consensus from different societies, institutions, and also countries. To our knowledge, our trial is the first large completed randomized controlled trial comparing intermediate dose anticoagulation versus standard dose anticoagulation in critically ill patients with COVID-19. Now, I would like to ask my good friend Behnoud to sum up the design of the trial.
Thanks so much for the opportunity, Parham. This is Behnoud Bigdeli from Brigham and Women's Hospital, Harvard Medical School, and also Center for Outcomes Research and Evaluation at Yale and Cardiovascular Research Foundation in New York. We've been truly honored to be a part of this collaborative effort, which encompassed several centers enrolling patients from Tehran and Tabriz in Iran, but also an international advisory committee that helped us try to understand and answer two very important clinically relevant questions in critically ill patients with COVID-19. The first question that had been lingering around for quite some time was whether we can try to mitigate the excess thrombotic events in these patients. And in this particular case, our hypothesis was that intermediate dose anticoagulation prophylactically, meaning with doses above and beyond standard prophylaxis, but lower than fully therapeutic doses, can mitigate the thrombotic event rates, microthrombosis and macrothrombosis, thereby reducing even mortality. That's hypothesis one, compared with standard prophylaxis. And then we had a second hypothesis, which was around thromboinflammation, thinking that use of atorvastatin 20 milligrams once daily compared with matching placebo would confer additional benefits for either micro and or macro thrombosis, thereby potentially even impacting mortality, as was observed in HARP2 sub-studies. And so we were hopeful that that might have an impact on outcomes as well. So to address these questions, we designed Inspiration and Inspiration studies with 2x2 factorial design. Patients with critically ill COVID-19 were being randomized initially to anticoagulation with standard dose prophylaxis, similar to what was happening before COVID-19, versus intermediate dose anticoagulation. And then they were followed for at least 30 days for the primary composite endpoint of all-cause mortality or venous or arterial thrombotic events for brevity. Now, patients being randomized to the first randomization also had a second randomization to statins versus matching placebo if they met additional eligibility criteria, which in short included lack of risk for serious bleeding events and also having been adult patients with RT-PCR confirmed COVID-19 being admitted to the ICUs. For sample size calculation for the initial anticoagulation hypothesis, we assumed that 600 people would provide us sufficient power to detect a clinically significant 12% absolute risk reduction for the primary endpoint. And for that reason, we considered to enroll 600 patients. For the second randomization, patient enrollment continues to date. We are happy to state that enrollment for the first study for Inspiration, anticoagulation hypothesis, has been completed, and patient follow-up for the primary events have been completed as well. And Parham is going to share the primary results with you momentarily. Thank you.
Thank you, Behnoud. As Behnoud has explained, the primary analysis was accomplished in modified intention to treat. So of 600 randomized patients, 562 patients entered to MITT analysis. The primary efficacy outcome occurred in 45.7% of intermediate dose group and also 44.1% in standard dose group without any clear benefit. Major bleeding was occurred in 2.5% of intermediate dose group and also 1.4% in standard dose group. Severe thrombocytopenia was detected in 6 patients, all assigned to the intermediate dose group. Less severe form of thrombocytopenia was detected with similar distribution in both study arms. We, along with the author, we will continue our analysis on different subgroup, and I think in a few days we will share the final results. Meantime, based on Inspiration trial result, we cannot advocate the empiric use of intermediate dose anticoagulation in critically ill patients with COVID-19. We will wait passionately for the result of ongoing randomized control trial on other antithrombotic regimen. Thank you very much for your attention.